Hello everyone, this is Dr. Bob Browner recording coronavirus update number 28, and we'll talk about the latest numbers which are leading to a lot of the states reversing their openings and requiring masks now, and just a brief comment about health disparities, which is something else we need to worry about. So if you haven't been following the headlines, it'd be hard not to know that the coronavirus spread has gotten much worse in the United States the last few weeks. We had the big peak that was on New York and New Jersey and the East Coast. It was getting better, and then of course we've had a huge blossoming of cases in the South that prevented our improvement, unfortunately. If you look at case after case, Florida, Arizona, Texas, California, all of them are hitting those basically exponential growth phase, and they all waited too long to make a difference in reverse course, unfortunately. And so we're seeing a huge increase in cases. If you want to look at it proportionally, kind of how bad things were in New York and New Jersey at the start, you'll see that Arizona actually is approaching, New Jersey and New York bad, and quite a few other states. You can't read it as well, but they kind of get lost in the shuffle here. But it's Florida, South Carolina, Louisiana, Texas, California, state after state going up just like they did, and unfortunately really not learning from the mistakes of the past. Nebraska, we kind of had our early mistake with our meat processing facility, started getting better, but unfortunately we're kind of hovering now too, and I'm worried that we have started opening up too soon without tamping things down to where they need to be. You'll notice that New York is far down here, and this 50 per million, or if it's by 100,000, which I'll show in the few other slides, most countries think you need to be at least down to 5 per 100,000, or even the zero point 0.5 range to be safe to open, and a lot of our states just didn't wait to get there, and they opened prematurely, it looks like. So why the problem? I would say one is people opened too soon to ignored the epidemiologists and the evidence from other countries who were doing it well. In addition to that, there was no communication plan about masks and distancing, and that without that preparation, it was too early to open. Along with that, there was inadequate testing to make sure that things weren't coming back, and also we were too slow to respond when it did start coming back. And so, kind of like a quote last week, I quoted George Will in Leadership: "To govern is to choose always the basis on the basis of imperfect information." And when information is imperfect, you have to be more cautious, not more reckless. And unfortunately, we chose the more reckless route to the south of us. So what about here locally? So it doesn't mean we have to repeat the mistakes of the past. So again, looking at these numbers, and I've been talking with Ali Khan at the College of Public Health, who's talked to international contacts overseas. The countries that have done it well, have really pushed down to not just 5 per 100,000, but even in the zero point 0.5 per 100,000 range. So if we're going to set different, green versus yellow versus orange versus red, we should learn from the people who did it right. Lincoln's kind of on that cusp. We had been going down. It looks like we might be creeping up here a little bit, probably because there's too many people not behaving themselves at bars and graduation parties. I think in Lincoln, we're kind of on the cusp here of maybe starting to see some resurgence ourselves. Most worried about Douglas and Sarpy County. They're at 3 times what would be considered a minimal level of safety internationally, and so they really need to reconsider tamping things back down again, or at least really doubling down on the mask education. Out west, Adams and Hall County really have really tamped down their epidemic. They're in that pretty low range, and of course it varies a lot across Nebraska, county by county. So that's why we made this Tableau, public Tableau site available, so you can kind of click on your county and see what you want to look like. Individual counties like Gage County, the numbers are really small. You'll see that this is, I believe, was their nursing home outbreak right in the initial stages. This is probably a little spillover from maybe some of those Crete, Smithfield plant, which is the neighboring county, but otherwise has been pretty low, and they're in a pretty safe level, unlike some of the rest of us. So again, the Will Rogers quote, there's some three kinds of men: the ones who learn by reading, the few who learn by observation. We've had plenty of observation. Do we all still have to pee on the electric fence here in Nebraska? I certainly hope not. And the reason why is that if you're down in the one case per 100,000 level and that goes to 500, you can handle that. You can get on top of that with contact tracing, and you're not going to exceed your hospital capacity. But if you're going from 15 cases, you can blossom up to 7,500 really quickly, especially with the slow turnaround and bad communication on testing so far. And essentially, this is kind of what Florida did. They opened things up right here, and even within a week or two, they started to see some hint of resurgence, but didn't do anything about it until really about here. And so this is way too late. Once you start seeing that upswing, you need to start acting, especially with a long incubation phase, asymptomatic spread, slow test turnaround. You've got to have a hair trigger on responding to something like this, and not simply let it simmer for weeks, because it then grows out of control pretty quickly. So where are we in Nebraska? We're in Lincoln, Lancaster County. I think we're on the edge. We could keep pushing this down if people start doing a better job of masking at the grocery store and at the coffee shops and things like that. But if we keep ignoring it and keep having these big graduation parties, we're going to see ourselves going right back up, kind of like Florida and these other states are doing to the south of us. Again, Douglas and Sarpy County, I'm worried the most about right now. So the big thing deals is masks. All the evidence is now combined. I'm not going to revisit the mask evidence that we spent the last two episodes covering. That the evidence behind wearing masks is really rock solid right now, and a lot of the concerns really are not justified, except for maybe young children, which we'll get to in a minute. But what you're seeing now is all these Republican governors to the south of us reversing course. Florida, Texas, Arizona saying no, we are going to start shutting down. We are going to have everybody wear masks now, because this is the cheapest, most effective way to get out of this epidemic is to get more people wearing masks. The good news is you're finally starting to see some leaders modeling it. So Mike Pence here recently giving a speech, making a good show of putting his mask on and off for the audience, saying we encourage everyone to wear a mask. And so I think people are finally realizing, no, we really do need to wear masks to slow this thing down. Even like this, I grew up in western Nebraska, so I like the mask up Wyoming because it turns out even a bandana like this might be good enough, for example. So we just know how to cover our mouths to prevent those coughs and droplets from spreading, and that would be the way to get us out of there. And so the way I keep explaining to people, it's like Swiss cheese. We know a mask isn't perfect, but a lot of things aren't perfect. But a lot of things in public health are this way. You do not have one perfect intervention, so you need layers of things. And so one analogy I would use to layers of Swiss cheese, it's like driving safely at night. You need headlights, you need brakes, you need a seatbelt, and I would want all three of them. And I certainly wouldn't drive anywhere at night without brakes, but I want headlights and a seatbelt too, because even with brakes and headlights, there's drunk drivers out there in the 2 in the morning, so I want my seatbelt on just in case. Well, essentially the headlights, that's like your distancing, the brakes are like your mask, and the seatbelt is like your hand washing. Again, the mask is probably the most important of the three, but they're all necessary. So just like returning to school safely, we need 3 to 6 feet of distancing, masks, hand washing, and potentially cohorting might be enough. The other thing to keep in mind is masks might not be necessary in the youngest kids, and it's going to be hard to get those kindergartners and first graders to wear them anyway. We know that. We're not stupid. We've worked with children. I've raised three myself. So quit overreacting on the masks in kids yet. We don't know. There's still evidence coming out. We don't know about the spread in elementary and preschool level. There's some evidence that maybe preschool isn't a risk, in which case maybe we don't have to have the kids wear a mask. But the evidence is literally changing on a weekly basis, and we've got 6 weeks before school is open. We'll look at the mask, the evidence as it comes in. We'll make a decision based on evidence, not based on Facebook posts and screaming and yelling. This is the time to be calm, look at what the evidence tells us, and respond to that evidence. And we are definitely looking at that evidence. So again, in the rationales works, and they've actually even repeated some of these studies. These were old Navy studies about droplet spread, and there's even a good YouTube video about a reporter in a hospital actually they had the guy coughing, and sure enough, this does pan out. That talking quietly gives you about 3 feet at most, but yelling, sneezing, coughing can push it way out here. The key is that no, you just wearing a mask isn't enough. Both people need to wear a mask, and if both people wear a mask, it could be anything from a face covering to a homemade mask to a neck gaiter, maybe even just a clear face shield, for example. So we're still working on that, but there is not any debate in the medical field right now that everybody, as many people as possible, at least in adults and older children, should be wearing masks. Like I said, there may be some evidence that maybe we don't have to do so in preschool and early elementary, but until the evidence comes out, it's too early to be making a decision. So people keep saying they want to know right now what the decision is. Well, there isn't a decision yet because the evidence is still coming in every few weeks, and we get a new study every week. We will make the decision based on the best evidence in about 4 to 6 weeks. So asking for a final decision is not realistic, and honestly, we're going to have to keep changing what we do in our strategy as we go. It's like playing a football game. You're not going to have one play all game long, especially if you're losing. You're going to have to change your play as you go. In our school year and our response to coronavirus needs to have that level of intelligence. You can't just make one decision and stick with it and never change. This is a thing where you want to adapt as you go with the new evidence as it comes in. So are there mask exceptions? There will probably be some, but we will get to those in the future. So don't start running out to your doctor and asking for a note saying you don't have to wear a mask, because he or she doesn't have the evidence yet either. So we'll start looking at that evidence as it comes in. There are certainly some medical conditions where some kids may not be able to wear a mask. Certainly there's some autism and behavioral conditions. There may be a PTSD condition. Younger children, if we're lucky, and key is if we're lucky, and there is some early evidence that maybe kids don't spread it as much, in which case maybe we won't have to have the kindergartners and first graders wear a mask, but we don't know that yet. We'll know that probably have a much better idea in about 4 to 6 weeks, and so that'll change things. And I think the face shield may be an option too, but again, that evidence is still, that jury is still out as well. So we need a little patience from everybody to quit honestly freaking out, calm down, wait for the evidence to come in. We've got 6 weeks to open the schools. We'll do it in the most safely effective manner we can, because we want your kids in school just as much as you do. The other thing I want to talk about briefly is that we also need to get past some of this stuff because there's going to be a lot of after effects of coronavirus. One of the things is we're seeing a drop nationally in some things in well child care, like childhood vaccinations. This is Dr. Gary Antone giving a talk about how even Nebraska, we're already seeing a drop in childhood vaccinations. This just adds to the health disparities we already have in Nebraska. And most people don't realize Nebraska has been dropping in America's health rankings for several decades now, and our single worst area is health disparities. And that's what I do in my day job. And so, for example, I work with our schools about trying to get the kids more physically fit. Obviously, this is going to throw things for a loop. So, for example, we know that the fitness rates vary dramatically based on ethnicity. With some of our minority and low-income populations have the lowest physical fitness rates. We need to change that and fix that. We have problems with diabetes, for example. So our the very populations that are getting hit most with coronavirus, like our Hispanic and Asian and African American populations, have lower rates of control of their diabetes while also having more diabetes. We've been working on this locally, and actually we've had actually have a nice steady trend in reduction in the number of out of control diabetics. We're hoping the coronavirus doesn't reverse all that. We'll find out in the future. This one here is breast cancer screening across the state. You'll see dramatic reductions, especially back where I am, where a lot fewer people get breast cancer screening there in rural areas than urban areas. And even influenza vaccination. This is going to be a big deal for us because the last thing we want is a bad flu year on top of a bad coronavirus this year. So we need to really work on improving our vaccination rates this fall. So at the end of the day, what we really need to do is have people start looking at the evidence. So this is what I do for a living. These are not, hastily decided things that we're talking about. We really want you to sort of slow down a little bit, look at what the evidence is, dial things back a little bit, and we will come out with the best evidence to get the kids back to school and hopefully prevent us from having the same type of outbreaks that we're seeing to the south of us right now.